Role of frontline workers in prevention and management of coronavirus. As a community worker, you have two very important roles. A. To spread messages in the community about measures people can take to prevent the infection. B. To take actions for early detection and referral of suspected COVID-19 cases. You can do this by preparing a list of all people who have travelled to other countries or other states inside India recently and inform them that they should monitor themselves for symptoms of COVID-19 and maintain distance with other family members as much as possible for the next 2 weeks. Share their names with your medical officer at PHC. When people with suspected COVID-19 report to the PHC or higher health facility, they may be put in isolation and their family members and close contacts may be put under home quarantine. The purpose of quarantine and isolation is only to control the spread of the disease for a period of 14 days, as it takes around 14 days for the symptoms to show. There is a growing concern of stigma and discrimination against people suspected of having the virus. This leads to mistreatment of such people and affects their mental well-being as well. Why is there stigma? COVID-19 is a new disease about which new things are still being discovered. When something is unknown, people are worried, and this leads to fear. Rumors of fake news give wrong information and spreads the fear. What does stigma do? Makes people hide their problems, keeps people away from accessing health services and seeking help. What can the frontline worker do? COVID-19 can happen to anyone. Speak to people. Be available to listen to how they feel. Ask people to stay away from watching negative things on TV and also fake news. Emphasize that most people do recover from COVID-19. Amplify the good news about local people who have recovered from COVID-19. How to take care of yourself and carry on with your duties as a frontline worker. Take all preventive measures that you are talking about in the community. If you are accompanying a suspected case to any health facility, make sure to cover both your mouth and nose with folded cloth or mask. People in a meeting should not be larger than 10 to 12 people. Self-monitor for signs of illness and report to any medical staff. Try to ensure that you continue to undertake tasks related to care of pregnant women, children, and other people with illness. Remember, older people are at a higher risk, so take special care to visit homes of elderly people. You should support A&M and medical officers with information on people who are at high risk for COVID-19. Also, as the people's trusted health worker, try to reassure them that while those with symptoms and high risk need close attention, for others, prevention measures will decrease the risk of getting the disease. Frontline workers, you can make a difference. Thank you.